Many dental practices still think HIPAA is mainly a hospital problem. But if your office files insurance claims electronically, sends referrals, stores digital x-rays, or uses practice management software, HIPAA applies to you too. In other words, a small dental office can have the same compliance obligations as a much larger medical group. And this is not just paperwork. When dental practices get HIPAA wrong, the cost can show up as fines, breach response, lost patient trust, and damage to the reputation you spent years building. Here's the simplest way to understand it. HIPAA is about controlling how patient information moves. In a dental practice, that information moves everywhere. It sits in charts and treatment plans. It appears in digital x-rays and intraoral photos. It travels through reminders, billing messages, lab orders, referrals, and front desk conversations. If that flow is not protected, the practice is exposed. Start with records. Dental records are full of protected health information, or PHI. That includes names, contact details, medical history, periodontal charting, prescriptions, insurance data, and clinical notes. Paper records should be locked up and limited to people who truly need them. Electronic records need role-based access, so a team member only sees what their job requires. They also need audit trails, which simply means a record of who opened what and when. Now think about imaging. A digital X-ray is not just a picture. Under HIPAA, it is Electronic Protected Health Information, or EPHI. The same goes for panoramic images, CBCT scans, and intraoral photographs. Those files should live on encrypted systems with secure backups. If a cloud imaging vendor stores them, that vendor usually needs a Business Associate Agreement, or BAA. And if images are shared with a specialist or insurer, they should be sent through secure encrypted channels, not ordinary email. Patient communication is another common trouble spot. Yes, you can text appointment reminders, but the message should contain as little sensitive detail as possible. "You have an appointment tomorrow at 2" is safer than "Your root canal is tomorrow at 2." The same principle applies to voicemail and email. Keep it minimal, keep it secure, and if a third-party reminder platform handles patient data, make sure a BAA is in place. Then there's the front desk, where small habits create big risk. A monitor facing the waiting room, forms left on the counter, a staff member speaking too loudly on the phone, calling out a patient's procedure in a crowded lobby. None of these may feel dramatic in the moment, but together, they create easy opportunities for unauthorized disclosure. Privacy screens, lower voices, clean counters, quick logouts, and careful sign-in procedures go a long way. Technology matters too. Your practice management system should support unique logins, automatic log-off, encryption, and access controls. Your guest Wi-Fi should be separate from your internal network. Software updates and firewalls are not optional extras. They are basic safeguards. At the center of all of this is one requirement many dental practices overlook: the security risk assessment. Think of it like a full walkthrough of every place patient data lives, travels, or could leak. You inventory your systems. You identify threats and weak points. You measure the likely impact. Then you prioritize what to fix, document it, and review it again at least every year or whenever something major changes. If HIPAA compliance has a foundation, this is it. Training is the part that turns policy into daily behavior. Dentists, hygienists, assistants, front desk staff, office managers, even temporary workers all need training. Not just once, but regularly. People should know what counts as PHI, how to share records correctly, how to dispose of documents, how to report a possible breach, and why social media is especially risky when patient images are involved.
Most violations are not caused by villains. They are caused by routine shortcuts. An unencrypted laptop, a missing BAA, records tossed in regular trash, staff snooping without a valid reason, X-rays sent through unsecured email, a patient photo posted without proper written authorization. HIPAA problems often start small, then become expensive very quickly. The good news is that compliance becomes much easier when the system is built for the way dental practices actually work. HIPAA Agent helps by automating core pieces of that system. It can guide security risk assessments, generate dental-specific policies, support staff training, track business associate agreements, and help document the evidence practices need to stay organized and audit-ready. So here's the takeaway. HIPAA for dental practices is not about turning your office into a legal maze. It is about designing everyday workflows so patient information is protected at every step. From charts to x-rays, from the operatory to the front desk, from a text reminder to a lab order, every touchpoint matters. If your practice handles patient information electronically, HIPAA is already part of your job. The real question is whether your systems, your team, and your habits are ready for it.